G'day everyone, Buck up in far north Queensland for a totally unrehearsed film clip. Unrehearsed because there's just too much to rehearse. It's important, this one, it's on snake bite. If you get tagged by a snake here in Australia, everyone. Listen, if you love hiking, camping, four-wheel driving, even fishing, listen into this. If you don't know the first aid treatment for snake bite, please listen in, show all your family this as well. I'll try and be as quick as I can. It's going to be pretty in-depth, but there's a lot to go through. It's an important subject, everyone. We've got all the bad snakes down here in Australia. We've got the world's most venomous snakes, and there is a fair chance at some stage in your life that you're going to come in close contact with a snake. I've lost count how many close calls I've had, especially in the army. I've had them go through my legs and under my legs and all that type of stuff. A couple of people each year die from snake bite. Lots of people getting bitten by snakes here in Australia each year. Lots. And the thing that keeps them alive is what I'm going to talk about today. And that's first aid and snake bite treatment here in Australia. The method, I'll get right into it, is called the PIT method. Pressure immobilisation technique. Pressure, getting pressure on there and immobilising the patient, meaning they don't move. When a snake, we have elapids down here, so when they inject you with venom, the venom travels through your system via the lymphatic system, okay? It travels through the lymphatic system. And the best way to slow the venom down is to apply pressure bandages. At the end of this clip, I'm going to give you a demonstration on Jamil. he's volunteered, force volunteered, and I'm going to give you a demo of how to do it. There's a few teachings out there. This one's from the Australian Resuscitation Council. Guideline 9.4.8, envenomation, pressure immobilisation technique, okay? Very, very important. If you don't know how to do it, guys, please keep watching. Show the whole family this. It could save someone's life. We're going to go through, have a quick chat. I've highlighted a few serious points here that I need to bring up to you. So I'll do a little bit of reading first, okay? And it's straight out of the Bible there. So you know I'm not just making it up. It's from the Australian Resuscitation Council. Guideline 9.4.8 if you want to read it yourself or download it. We'll go through what should be in your snakebite kit. And then at the end, as I said, I'm going to give a demo on Jamil on how to apply a snakebite bandage. Pressure immobilisation technique. As I said, the venom travels through the lymphatic system. There's a fair chance, probably 99% of the time, if you get bitten by a snake, it's either going to be on the lower limb, walking through grass or long grass or whatever, or you get tagged on the arm, picking up firewood, collecting firewood or whatever, or if you're stupid enough, trying to catch the bloody things and they tag you on the arm. Before, if I forget to mention it, if you see a venomous snake, leave the bloody things alone and don't try and catch them by the tail. How many of these professionals do you see tagging snakes by the tail and they fling back up and they bite them? And even the professionals can come unstuck, guys. So if you are not a professional snake catcher, don't do it. Says me, who's just on one of my clips caught a couple of mildly venomous brown tree snakes in here. I have got a snake catcher here, and listen, I live in a country town. Trying to get a snake catcher here is probably next to impossible. So there is a chance I may have to. I've caught a lot of snakes in this shed, guys, but well, luckily for me, they haven't been browns or taipans or death adders, okay? I haven't seen them in here. Doesn't mean they haven't been in here. I haven't seen them in here. I get the doll's eyes, the brown tree snakes, which are mildly venomous. Get a lot of those. You can see a skin hanging up in the rafters as we speak, and I've had some big pythons in here. You don't want to get bitten by them either. They got big sharp teeth. But if you get tagged by one of the bad boys here in Australia, if you do not apply the pressure immobilisation technique and you don't get to help in a hurry, you're in deep shit. A lot of the snakes here, the browns and the taipans, the death adders and that, if you get bitten by one of those and you don't do the first aid being pressure immobilisation technique, there's a fair chance within half an hour you could be dead or very close to it or showing very bad symptoms. Okay, Luckily for us now, all our venomous snakes, which are elapids here in Australia, they've got antivenin for them, okay? So the idea of this, first aid guys, it's your first go-to thing, is you apply first aid. We apply the pressure immobilisation technique, which as I said, you'll see at the end of this clip, and then you get to help as quick as you can, because most hospitals and that in Australia will have stock of antivenin. Obviously, up here in Innisfail in far north Queensland, I dare say my local hospital had antivenin for brown snakes, death adders, and taipans, okay? Down in Tasmania, they'd hold antivenin for tiger snakes and whatever venomous snake is around your area, copperheads and all that type of stuff down in Victoria. But the thing is, if you get tagged, you need to do this, or there's a fair chance, if it's one of the bad boys, you will die. Not you might die, you will die. If they envenomate you, an eastern brown, second most venomous snake in the world, you're gone, guys, if you don't do this. So please listen in, take note, and we'll run through a few things. I'll go through this first, and then we'll go through what's in my snakebite kit. We'll come on to that later. I'm going to read this straight from here, guys, so you know what I'm on about. I've just highlighted some major points. Pressure immobilisation technique was introduced for the treatment of Australian snake bites and is suitable for other elapid snake bites. Other elapids, I'm thinking over in South Africa, probably your cobras and your black mambas and that are elapids. So if you're in South Africa, this may apply to you. But this is the one that works on venomous Australian snakes, being they're all elapids, okay? Even the death adder, which isn't really an adder, it's an elapid, guys. So there's different ways to treat. All our venomous snakes are elapids, and they're all treated the same way. The pressure immobilisation technique retards the flow of lymph by which venom gains access to the circulation. So as I said, the venom goes through the lymphatic system, and by applying pressure bandages, it slows it down considerably and allows you time to get to help. Now, the pressure immobilisation technique is recommended for certain bites and stings from certain creatures. So, all Australian venomous snakes, including sea snakes. This method works even on sea snakes. That's why I mentioned boating before. If you get tagged by a sea snake, which is probably unlikely, they're rear-fanged, but they are highly venomous. And so make sure you get a snake bite kit if you're a fisherman. You never know. Funnel web spider, same method. If you live in Sydney or Toowoomba, you got funnel web spiders, same thing here. This will link. Blue ring octopus. If you go swimming down in the rock pools of New South Wales and all that, where there's blue ring octopus, this will work on blue ring octopus, who are bloody highly venomous as well. And cone shells. There you go. Even our shells down here in Australia can kill you. Cone shell bites. It is not recommended for other spider bites, including redback spiders. Don't use it for redbacks, jellyfish stings, stonefish bites, scorpion centipedes, and beetles. I did not know there was beetles that could kill you here in Australia. Apparently there is. I've never been bitten by a beetle, but apparently we've got beetles that can bite you as well. That's good to know. Okay, so all snakes, funnel web spiders, blue ring octopus, and cone shells. Not for jellyfish and that, okay? That's vinegar and all that type of stuff. So I've highlighted a few things here. The pressure immobilisation technique, there's a few different ways that you can do it. Now, at the end of the day, people will go, oh no, you do it this way, you do it that way, and all this type of stuff. The main idea is that you get pressure on the entire limb and you immobilise the patient so that he's not moving. The more movement, the quicker the venom will flow. And once it starts getting up around your heart and that, you're in trouble. You've got to slow that venom right down. There's a couple of different methods. I'll talk about it now. Say I got bitten on the army, picking up something in the army, and a snake tagged me there. We were taught, now, I was in the army when Centurion was a rank, not a tank, guys, okay? It was a long time ago. This method is no longer the method to do, but this is how we were taught. It's very similar. They're all similar procedures. We used to bandage over the snake bite, down the limb, and the thinking there was like trying to force the venom down the lymph system away from your heart and that. So we used to bandage over the bite site, down the limb, and then all the way back up again. That's no longer the teaching. The teaching in here, and I'll do a demo of it, okay, the Australian Resuscitation Council, there's a couple of different ways, okay, and the main one is, it depends on what you're carrying in your snake bite kit or what you've got in your first aid kit. If I forget to mention it, don't carry one snake bandage. It's not enough. You need 2 or 3 of them, okay? And the reason is, if you get bitten on the arm now, what they do recommend, the best method, is to do a pressure bandage over the bite site. So the bite there, put the pressure bandage over the bite site. Then with your second bandage, you go from just above the fingertips, if you get bitten on the arm obviously, above the fingertips so that you can still test for blood flow on that. And then you do a nice compression bandage all the way up over the first bandage on the bite site, all the way up the limb. Then we immobilise. We can splint the arm. We can get the arm down and splint it to your body so that the person can't wave it around and speed things up. Okay, so if you've only got one bandage, the teaching then is don't do it over the bite site, just start there and work up over the bite site and then all as high up as you can go. So if you've only got the one bandage, you go from there, over the bite site and up. If you've got 2 bandages, over the bite site and then the other one over. And then if you need another bandage, it doesn't go up high enough, get another one, get a third one and keep going. Try and do the whole limb if you can, okay? That's why don't just carry one snake bandage. We'll go in and talk about snake bandages soon. The other one too is an acronym. It's DRS ABCD, and I'll put it on the screen. This applies to everything in the first aid world, everyone. This was the current teaching when I left corrections a couple of years ago. We used to do first aid refreshers every 6 months or every 6 months, I think it was, and we went right into this. This applies for everything. Danger. The first thing you do when you come across a patient is check for danger. If he's lying on the ground and he's unconscious, being bitten by a snake, that snake could still be under him. The snake could be still around. If he's been electrocuted, there could still be a live wire there. So the first thing we do is check for danger. There could be a live electric wires going off the track a bit now. The snake could still be in the vicinity. So danger, DR, response. Is the patient responsive? If he's sitting up and say, I've just been tagged by a snake, he's obviously, his response, he's talking to you, so he can still talk. You may come across a patient that's unresponsive and he's just lying unconscious on the ground, so he can't tell you what's happened to him. Danger, response. Check for danger, check for a response from the patient. The old bloody shake and shout method. You okay, mate? You okay? Can you hear me? Okay, when you come across them. If someone's unconscious, the first thing. Danger, response. Hey, mate, can you hear me? Can you hear me? Give them a shake. All right, they might be drunk. They mightn't have been bitten by a snake. You might be pissed lying in the gutter. Give them a shake and shout. I think that's still the current teaching. It used to be the old pinch the ear and all that. You can do that a bit later on. I've done that as a copper. Drunk people in gutters that can't hear you, give them a pinch and the old pain soon wakes them up. But shake and shout. Can you hear me? Can you hear me? And get a response from them. S. DRS. Send for help. If someone is tagged by a snake and you are remote, you need to get help on the way ASAP. Danger response, send for help. That might mean get on your mobile phone if you've got whatever. Dial 000, dial 112 from a mobile phone. If you didn't know that, 112, if you've got a Telstra phone and you dial 112, that's emergency for a mobile phone. It will pick up any Mobile phone tower, whether it's Optus or Vodafone, it will pick up any phone tower because it says this bloke's with Telstra, but he needs to make an emergency call. We're going to let him use that Vodafone tower. That's the way I understand it. So 000 or 112 from a mobile phone. Send for help. 000, I need an ambulance. I've got a snake bite victim. We're out at campground at such and such a place. I'm doing first aid. I'm applying a pressure immobilisation bandage as we speak. I need an ambulance on the way here now. So danger response, send for help. ABCD, airway. All right, if they're conscious and they've been bitten by a snake, that's mainly for people choking and choking on their vomit, all that. Is their airway clear? Breathing, are they breathing? Circulation, pinch their fingers, do they have circulation? And D is for defibrillation. I don't know any four-wheel driver who carries a defib in the back of their four-wheel drive. A lot of work sites and that now have defibs, and if someone's heart's not going, you can put the defib on and try and shock them back and get their heart back into rhythm, okay? So DRS, ABCD, the most important ones: danger, response of the patient, send for help, ABCD. The first three are the main ones, guys. Danger, response, send for help. Then we get stuck into it and we start applying the PIT, I'll call it, pressure immobilisation technique, okay? So I've taken you through that. Keep the victim and limb completely at rest. There's another one we always used to get taught: reassure the patient. If someone gets bitten by a snake, they're going to panic. It's only human instinct. You've got to keep them calm. The more they panic, the quicker that venom's going to go. You've got to reassure the patient and keep them calm, everyone. Not just for snake bite, for everything. You do not want your patient going into shock. You need to reassure the patient, even if you've got to bullshit to them. All right, if they've been bitten by a bloody death adder or a taipan, you're applying the bandage. While you're doing all this type of stuff, you're talking to them. You're going to be okay, mate. Keep still. Relax. Don't panic. Help's on the way. We've already been onto the ambos. They are on their way. We're going to get this bandage onto you. Okay, we're going to keep you nice and still. I need you to stay calm. We're going to get the bandages on. We're going to splint your arm up or your leg up so you can't move. And then the ambulance is going to get here and they'll get you then. You're only half hour from the hospital. They've got antivenin there, all that type of stuff. Keep them calm and don't let them panic. Easier said than done. I think if I got bitten by a snake, it's only natural that you're going to panic. But you've got to stay calm, especially if you're by yourself. I heard once on the news, this is a few years ago now, a bloke got bit. What's that? Some horrible bloody noise coming from the neighbour. Bloke got bitten by a brown snake. He rang 000, said, I've been bitten by a snake, get an ambulance here, this is my address. Ambulance was on the way. He applied a compression bandage to himself. He sat down and he had a beer to keep calm. I don't know if having a beer is recommended, but that was his way of staying calm because he knew he was in trouble. But he got the ambulance on the way. Now, people are going to go, what if you get bitten remote, Buck? What if you get bitten here? And you can't. This is where you need to make a decision, everyone. You need to make a decision. If you come across a patient and they're not breathing, okay, and they've been bitten by, you see the snake crawling away or whatever, and they've already, you know he's been bitten by a snake, and he's not breathing, you need to apply CPR, okay? That takes priority over getting a bandage on. How would you know he's been bitten by a snake? You probably wouldn't, okay? But CPR, in a nutshell now, forget this 5 and 1 and 15 and 2 and all these old practices now. CPR now is 30 compressions of the chest and 2 breaths. If you don't know how to do the breaths, do the compressions, okay? Middle of the chest, palms of your hand, and you're a third of the way down, okay? Compress the chest a third of the way. That gets the blood pumping through the system. So if someone is not breathing, you've got to do CPR before you worry about anything else, okay? Normally if people have been bitten by a snake, they will tell you they've been bitten by a snake, and that's when you have to do this. If you're remote, and there's two of you, and there's no use doing this and just sitting there if help's not on the way. You may have to apply the PIT technique, pressure immobilisation, get the patient into the back of your car, keep them as still as possible, carry them in there, reassure them, keep them calm. The rain's belting down again, it's just been like this for weeks up here. And you may have to drive with them on the back seat of your car until you get mobile phone reception. And then you ring 000 and say, I need an ambulance. I'm already on the way, I've applied a bandage, I will meet the ambulance at such and such a place. There's all different scenarios. You've got to make a decision, okay? And if you're out hiking and you've got no mobile phone reception, you get tagged by a snake and there's only you and your mate, then you're up for some hard work. You need to get that bandage on. You may have to carry him out on your back, okay? Because you don't want them walking out. If you're by yourself and you get tagged and you've got no phone reception, you're in deep shit, aren't you? You really are. You may have to try and walk to at least get a bloody phone reception. You've got to cross the bridge when you come to it. But most of the time, if we're out camping and that, you be with friends, you'll have someone to apply this technique, and hopefully everyone's got emergency comms. Satellite phone, Starlink, something like that, mini Starlink and all that. That's a game changer, isn't it? If you're going remote, I just highly recommend now, guys. I think satellite phones are fantastic when they work. I've had a sat phone, it was hit and miss. Starlink Mini, very, very good. I highly recommend that. If you're going to do a lot of remote travelling, if you don't have a Starlink Mini, I think you're mad for emergency comms. What I might do is stop the camera there, wait for this rain to settle down a bit. It gets very loud in the shed, rain belting down on the thing, and then we'll come back and I'll show you what's in the first aid kit. So just remember, DRS, ABCD, danger, response, send for safety, airway, breathing, circulation, defibrillation. Worry about the first three, okay? Keep the patient calm and start your pressure immobilisation technique, and we'll talk more about that soon when the rain stops a bit, eh? We'll go through my first aid kit, show you what's in there. Welcome back. The rain's eased off a bit, still raining, but at least you can hear me now. Hey, a couple of things I forgot to mention before the rain came down, guys. Some do nots, and make sure you pay attention to this bit. Do not panic. That's not just for the person who gets bitten by the snake, that is for the first aider, the person applying the pressure immobilisation bandages, okay? Don't panic. If the person being bitten by a snake sees you panicking, it's going to make them panic, and that does nobody any good. It's just going to make things worse. Start panicking, moving around, venom's going to flow quicker, all that type of stuff. And it's not just for snake bite, everyone. It applies for any sort of first aiding, even if you come across a bad accident. It's easier said than done, yes, I know, but you've got to stay calm. People, when they're in trouble, want to see, if you're helping them out, that you are calm, cool and collected. Okay, I've done it heaps of times when I was a police officer and a prison screw to some extent. Stay calm and bloody sound confident, be confident. Even if inside you're sitting there thinking, holy shit, what do I do here? Just be confident and stay calm, okay? The other one we don't do with snake bites. Ever seen the old Western movies in the old days? They get bitten by a rattlesnake and they cut it over and suck it out. Don't cut the wound and don't try and suck the venom out of the thing. You do not do that, guys. That's for the cowboy movies. Do not try and cut the site and suck the venom out. Do not wash the site. Why, you might say? Why don't we wash the venom off? Because if there's venom on the outside of the skin, when they take the bandage off at the hospital, they can swab it, they can get a swab of that, and they can identify the type of snake by the swab test. I don't know how many hospitals in Australia can do that. One would hope most hospitals can do that and identify. There must be some sort of little snake testing kit that they have. I don't know. If someone can help me out on that, it'd be much appreciated. Put it down in the comment section. Maybe they take a swab with a cotton bud, put it in a little test tube and shake it up, and it may tell them it was an Eastern brown, or it was a taipan, or it was a common death adder, or whatever it may be. So don't wash the side, okay? Don't cut it, don't wash it, and don't panic. That's the big one. Right, let's get on with what is in my snake bite kit here. I've got a first aid kit. I have a separate snake bite kit. You go into most places now. I know Adventure Kings does them. Most camping stores will have designated snake bite kits. So you'll have a first aid kit for cuts and wounds and all that type of stuff. Make sure you have a separate dedicated snake bite kit. Why? Because you don't want to be fumbling around through a first aid kit looking for things that you can use for a snake bite, okay? You know that snake bite kit there, which I got off Accidental First Aid Supplies, which aren't around. Jono, I think, used to own them. But a lot of your survival first aid, I know Adventure Kings has snake bite kits and all that type of stuff with the correct types of compression bandages in there that have a little square, and when the correct pressure is when it becomes a proper square. That's the proper tension. So there's designated snake bite kits out there. Have that in your four-wheel drive. Make sure everyone knows where it is. Have it in your boat. Have one in your boat. If you go hiking here in Australia, I always grab that. Not that I do a lot of hiking anymore, guys, but if I'm going to go for a bushwalk, I'll take that out of the four-wheel drive and throw it in my backpack. So if I got tagged or someone gets tagged on a hiking trail, going down, 500 metres to a waterfall, and you get tagged by a death adder hiding in the leaves on the side of the track, have that in your backpack. So a designated snake bite kit. What is in mine? Right, that's that bandage that sticks to itself, okay? It's good to have one of those in there. It's available on eBay. Look at my first aid kit clip. Set of scissors to cut that with, okay? Now, this is where the bandages come in. You don't want crepe bandages for putting around a cut, or if you cut yourself and you put it over, then you put a crepe bandage over to keep the dressing on. You don't want crepe bandages. If that's all you got, that's what you have to use, everyone. You want a good compression bandage, the ones that's got some stretch in them. That's a smaller one there. Now these ones I've used before on my old clip. I'm not dressing wounds with these, guys. I know people saying, oh, your bandages should be in the thing. These are applying pressure to a limb for a snake bite. So who cares if they're wrapped up or not? That's a small, stretchy bandage there. It's good to have a couple of these. Are cheap as chips. Triangular bandages, everyone. They can be used for a lot of different stuff. The main one is if you hurt your collarbone or something like that, you can put your arm up like that. But they can also be just rolled up and used to tie things. And we're going to do that when I splint Jamil's leg later on. We'll use a triangular bandage. They can be used for a lot of different stuff, guys. Okay, and even just using them as ties for a splint. So have a couple of good triangular bandages in your snake first aid kit, your snake kit I should say. What else have I got in here? These are the two big ones, so that's a smaller one there. That one there might be the one I put over the bite site, and then I use these two larger ones. See how they've got the stretch in there? I use these two larger ones to start at the toes or the fingers and then work my way up. So I'll be able to use the smaller one over the site to get pressure over the bite site, and then these two larger ones, I've got two of them, you can do the whole limb. Don't just have one bandage, everyone. We need to be able to put pressure up the whole limb, up the entire leg, right up as high as you can go, okay? So I've got two of those big bandages. I went into the pharmacy the other day and they actually had snake bite bandages in there, which was good. And they're actually, snake bite bandage is actually written on them. So I might open them one up when I do Jamil, and I think you'll find that one there, maybe, yes it has by the looks of it, has got the little, it'll be like a rectangle, so when you stretch the bandage it turns into a square, and that way you know you've got the right pressure. So we need to keep pressure up the entire limb. You don't want it too loose to still allow the venom to travel through the lymphatic system. We don't want it so tight that we're cutting off the blood supply. And That was the other thing. I knew there was something I forgot to say on do nots. Do not use a tourniquet on a snake bite. That was the other one. Do not use a tourniquet and cut the blood supply off. That is old practice and has been for many, many decades. Do not use a tourniquet. That was the other one I forgot to mention. And once again, you don't want the bandages that tight that you stop the blood. That's why we leave the tips of the fingers exposed. So when we bandage it up, and you'll see me do it on Jamil, pinch his finger, and you can see the blood come back. So that can create other problems, okay, if you cut the entire blood supply off. So if you do not have some good stretchy bandages, they actually sell the proper ones now, snake bite bandages that have actually got an indicator on there so that you know you've got the correct tension on there. So I fitted all that, or fit all that in there. Now what else have I got in here? Another good thing to have in there, and someone mentioned it on my last first aid thing, is have a pen or a Sharpie. These are called a Sharpie. So they're like a texter pen. Don't know what you call them where you come from, but it's like a texter pen. Why do you think we would need that? It is so, once you bandage the entire limb, what you can do, you've got to think ahead for the doctors and the nurses and that in the emergency department of the hospital. You can put a cross or a couple of dots or whatever and indicate exactly where under that bandage that snake bite is, because they have to be careful when they take the bandage off. So it's always good if the doctors know exactly where the snake bite is, because when they take the bandage off, they're going to want to inspect anyway. May not always be visible. Bloody snake fangs, very fine, very, you may not be able to see it. The bleeding might have stopped. So put an indicator of where the snake bite actually is under the bandage. And the other thing, a date and time. A time when that snake bite happened. What's the date today? About the 9th of Feb or something like that. So you go 09-1000. 09-1000. So on the 9th at 10 o'clock in the morning is roughly when the snake bite. So they can do their calculations, okay? I'm not going to go right into that. I'm no expert on that. That's where the doctors come in, okay? They can work out when to put the anti-venom in and all that type of stuff like that. I read somewhere once with these compression bandages, someone applied one, and when they took it off him in the hospital, they eventually took the compression bandage off. He said the pain hit like a freight train. So he said as soon as that compression bandage came off, you could feel the venom, like it just hit him, the pain hit like a freight train. So they do work. As I said, a lot of Australian snakes, if you don't get help within 30 minutes, you could be dead or well on the way to being dead. These compression bandages can buy you hours, I've read. So it's very, very important. What else did this snake bite kit come with? It comes with a little chart here. So if you do have a panic attack and you forget about it, it's got pictures of, it's got brown snake, death adder, red belly black, taipan, tiger snake. They're all the bad boys down here, or some of them anyway. One thing that does worry me, it's got poisonous snakes. There's no such thing as a poisonous snake, everyone. They're venomous. They're venomous, and spiders are venomous. They're not poisonous. Venom is injected. Poison is either taken or inhaled. Poisons, snakes inject venom, okay, not poison. There's a big difference there. But, oh, that snake's poisonous. No, it's not. It's venomous. It's either venomous or non-venomous. So I'm going to go through this. I've had this snake bite kit for a long time, except for these are new. I'm going to go through and just see what they say here that is still current. And if it's not, I will let you know. Snake bite treatment. Do not wash, cut or suck the wound. I've already told you that. So that's right. Apply bandage immediately. Okay? Firmly bandage starting from the toes or fingers, continuing up the limb as far as possible. And as I said, the practice is to go over the bite. If you've got enough bandages, go one over the bite and then we go up the limb. Either way is acceptable, everyone. You may not have a small one. You might only have one bandage, and it says there in the regulations, in the thing I had there before, if you've only got the one bandage, start and work up over the bite site, okay? If you have got the luxury of having another stretchy bandage, go over the bite side with a compression bandage, and then the second one you start working your way up. So that's correct. Do not apply any tighter than you for a sprained wrist. Once bandaged, you should need to be able to just get the finger under it. We don't want to cut the blood supply off. Once bandaged, immobilise the bitten limb with a sling or a triangular bandage, okay, which is what I said. So we need to stop the patient from moving. Keep patient still and calm. Movement will increase venom flow. Yes, we've said that, haven't we? Seek medical attention immediately. Danger, response, send for help. That's immediate, isn't it? Danger, response, he's talking to me, send for help. That is immediate. You need to get help on the way immediately. And if you can get comms with 000 and it's best to get them to come to you rather than try and get the patient to the hospital. If that's what you have to do, that's what you have to do. You've got to make that decision. But the best thing is get the bandage on, keep them still, keep them calm, and get the help to come to you. If you try and put them in your car and meet the ambulance halfway and all that type of stuff, that's probably worse. The movement and everything is probably worse than waiting the extra time for the ambulance to get there. If you can keep them calm and still, that's better than trying to move him and meet the ambulance halfway. Monitor pulse and breathing. If either, cease, apply mouth to mouth, CPR. So if they go on a shot and they stop breathing, you then have to apply first aid, guys, CPR, cardiopulmonary resuscitation. Say that after a few beers. All right, the old 30 on the chest and 2 breaths. EAR, expired air resuscitation. When you give mouth to mouth, that's what it's called, expired air resuscitation. If you don't know how to do that, just do the 30 pumps on the chest. It's better than doing nothing at all. Do something rather than nothing. Keep that one in the back of your mind for all scenarios, everyone. Where possible, bring the vehicle to the patient. I just said that. Do not try and catch or kill the snake. That was the other do not. Don't try and tag the snake and take it into the hospital and go, this is the one that bit him. It's a taipan. And next thing it comes up and goes, broop, and gets you. Don't try and catch the snake, everyone. They can identify the snake bite, as I said, by doing a swab test. If you have a good look at the snake and you can take a picture of it with your mobile phone and that, yeah, absolutely. But don't put yourself, remember, danger. Don't put yourself in danger. So everything on there is pretty well on the money, guys. And this is an old snake bite kit. Righto. So that's what's in my first aid kit, not my snake bite kit, I should say. Have a pen in there, make sure it works too. That's been in there a while, it still works, it's still fine, keep it down. And as I said, mark where the snake bite is. If it's down on the calf muscle or whatever, mark over the bandage where the snake bite exactly is for the doctors and put a date, time on there so they know roughly when the patient was bitten. And they can do their calculations. I think it comes into when they start applying anti-venom and all that type of stuff. If you got bitten at 10 o'clock and it's now 4 o'clock in the afternoon and they've had no sort of reaction and the bandage is, then there's a fair chance it could have been a dry bite. The doctors will determine all this. They have their procedures in the hospital. So don't think if you get bitten by a snake that you're going to die, everyone. It could be a dry bite. Sometimes they don't inject their venom into you. It could be a dry strike. If not, if they do inject venom, this is how you treat it in Australia, the pressure immobilisation technique. We need to get pressure on the limb, whether it's the leg or the arm. We need to get pressure up there with pressure bandages. We need to immobilise the patient, keep them calm, keep them still, minimal movement. As I said, stay calm, do something. If you don't have the proper bandages and all that, it says there on that handout that I printed out, even if you have to rip a t-shirt up, t-shirts have got a bit of stretch. Even if you had to cut a t-shirt up and get a stretchy t-shirt and wrap the limb up and put insulation tape at the end to keep it on. Doing something is better than doing nothing. So remember that. But I'm always saying, and I'd love to make it the motto of my YouTube channel now, be prepared, everyone. Be prepared when you go out camping or you go hiking or whatever. Be prepared, have a think about some likely scenarios that could happen and be prepared to deal with it. And snake bite, let's face it, it is a very, very real possibility here in this country. It really is. I'm sure a lot of people out there have had close calls with snakes. If you haven't, you're probably a city dweller or whatever, but if you go camping and you love to go out in the bush, I'll tell you what, if you haven't got one of these, you are mad. So please, go out and get yourself a snake bite kit. That's what you should have in there. Okay, if I've forgotten something, put it down in the comments and let me know. A couple of nice big stretchy bandages, at least 2, maybe 3. I've got a smaller one here, that will go over the bite site, and then I'm going to do the whole limb with these big stretchy bandages. Go out and get the proper snake bite ones if you can. I like the bigger ones. You cover more of the limb, so you get it on nice and firm, keep that compression on. Triangular bandages, keep them in there so you can put a splint on. A splint might be, you might have a splint in your first aid kit. You might have to use a tree branch or something so that they can't move. If they get bitten on the leg, you might have to sit them down and tie their legs together. Use the other leg as a splint and tie a couple of triangular bandages, one down around the ankles, one around the knees, so that they can't move. They keep nice and still. That's what they're for, okay? They can be used for a lot of other stuff with first aid, but with snake bite, that was what you use to splint the limb. Now, as I said, if you get bitten anywhere besides the legs or arms by one of the bad boys, you're in deep shit, everyone. You are in deep shit. If you get bitten on the neck or the torso or whatever, if you do get bitten on the stomach, they recommend to still try and apply a bandage on there, but don't have it so tight that it restricts your breathing and all that type of stuff. And then you are gonna have to get that person to hospital ASAP and get the anti-venom into them, okay? 99% of the time when people get bitten, it's usually on the arm or the leg, okay? In the army, we had procedures in the army. When you got up at 2 o'clock in the morning, off the ground in your sleeping bag, because we used to just sleep on the ground, and you had to go away for gun picket, you rolled your sleeping bag up. You rolled it up. You did not leave it out. So when you come back after 2 hours of gun picket and get back in your sleeping bag, there's not a brown snake waiting in the bottom of it for you, because they'll crawl in, or a nice warm place. I'll go in there. I've heard a horrible story of an American soldier out here on exercise many years ago, got tagged by a snake that was in his sleeping bag because he left it out. If you ever take your boots off out bush, take your boots off out camping, okay? Don't leave your boots open. Put your socks over the top so nothing can crawl inside you. Funnel web spider or a bloody horrible spider can't, or a scorpion can't crawl inside your boots. Teach this to your kids, everyone, okay? Zip your tents up when you're out camping. That's a big one. Don't leave a little gap at the bottom of your tent so when you come in at night to go to bed and it's nice and there's a snake in your bloody tent, in your Oz tent or whatever. Zip them up properly. Teach your kids to do it. Train them and teach them all about snake and snake safety and all that type of thing. It's a real deal here in Australia, everyone. I can't stress that enough. It is a real deal. The chances of getting tagged by a snake in this country when you are out camping, what's the old saying? Fair to middling. There's a chance it could happen, and I've had a couple of really close calls. I'm going to tell you one. I was under my cam net one day in the army, and I was sitting on a chair, and a young fella come under my cam net to ask me a question. Hey, so I was a sergeant at the time. He goes, "Hey, Sarge," and he paused, and I said, "Yeah, what's wrong, mate?" He goes, and he didn't speak, and I'm like, "What's going on?" I didn't know. Snake, brown snake going under my chair. I was sitting in a chair, like an old army fold-up chair. Brown snake went through my feet under the chair. I didn't see it, or I would have gone through the top of the cam net. And then once it got away from me, he said, "Hey, Sarge, brown snake just went bloody under your chair." And I turned around just to see its tail go under the cam net. And he said, "That thing went straight between your legs and under the chair." So that's the type of close calls you can have. Luckily, I didn't move. They reckon if you don't move, it's only when you move, or you've got to be unlucky to get bitten by a snake here, guys. You've got to step on it. You've got to accidentally go in where it is to try and pick up some firewood, and there's a snake in there, and they will bite to defend themselves. They don't attack you, but they will bite if you startle them. And whatever, you're walking through the bush and that, have a big stick. and tap the ground in front of you. All right, there's a lot of tricks out there that you can use to minimise the chances of get tagged by a snake. If you don't need to walk through long grass, don't. All right, it's common sense stuff, isn't it? But common sense isn't so common in this country. People still do dumb shit. Righto, the next time you see me, Jamil will be out and we're going to pretend he's been bitten on the leg or the arm, and I'm going to run you through the procedure. I hope you're getting something out of this, guys. It's very important. It is very, very important. Imagine your kid getting tagged out camping. All right, you got to stay calm. As much as you'd be panicking inside, you got to stay calm, keep your kid calm, get the first aid done, and get help there and get them to the hospital ASAP. If you don't know what kind of snake it was, always treat a snake bite, even if it was a bloody brown tree snake or a green tree snake and it's non-venomous, treat every snake bite like it's from one of the bad boys. Better safe than sorry. Hey, just quickly, if you saw my first aid my first aid kit, I was going on about this coloured stretchy stuff that sticks to itself, like it sticks to itself when you wrap it around. Even that by itself, it's got some stretch there, okay? If you've got enough rolls of that, you could use that as a snake bandage. Even that would be perfect for a snake bandage, but the idea is to probably make sure you've got some nice big stretchy compression bandages, not crepe bandages. Crepe bandages don't stretch, compression bandages do. So make sure if you do go and buy bandages, they are compression bandages, everyone, not crepe bandages. Big difference. Righto, everyone, as the rain falls down, I want to introduce you to Chris here. Chris, welcome, mate, and thanks for coming over. Chris is my guinea pig for this afternoon. He's a friend of Jamil's, everyone. Jamil wouldn't do this afternoon, Chris, because he reckons his legs were too hairy and he hadn't waxed. So we had to get you around. Thanks for coming around. I needed a thing. So what we're going to do now, we're going to pretend that myself, Chris and Jamil are out camping, one of the local campsites around town here. You were out checking for some firewood.
Yep.
Chris has come over and said, I've just been tagged by a snake. First thing I'm going to do is go, mate, sit down, don't move, relax, keep still. Then I'm going to say, did you get a look at the snake?
Yep.
What did you see?
It was a shiny black snake and it slithered away, and I think it was a red-bellied black.
All right, so we've got a bit of an idea now. Chris is out looking for firewood, 20 metres away, gets tagged by a snake. We'll use this right leg as a bit of thing. Just around the calf muscle there, the inside of the calf, bottom of the calf muscle. He looked down, saw a shiny black snake with the red coming up its side. They're a common snake around Australia, red belly blacks, highly venomous. So you automatically go into, you've got to start moving quick, guys, without panicking. We don't want him to panic. We want to stay nice and calm. So we want to reassure the patient and that. We've kind of got an idea of what kind of snake it is. We don't need to go catching the snake, but it is handy if you do get some sort of look. So when you get to hospital, you can kind of give the doctors some sort of indication of what it might be. It could help them out. In case you're not aware, mate, when you get to hospital, they can swab the area and do a test and work out do a swab test on the venom. That's why we never wash the area there. So obviously I wouldn't be talking like this if Chris has just been hit by a snake. Danger, the danger's gone, the snake's crawled away into the bush. Response, Chris is still responsive at the moment. I'm keeping him calm. DRS, send for help. So we're at a campground here. We've got reception. I've got a third person here. So if it was just me and Chris, maybe I'd have to make that 000 call or the 112 from a mobile phone. I've got Jamil over there. He's got a mobile phone. I will go, Jamil, call 000, tell them we've got a snake bite at such and such campground. Chris has been hit. We suspect it may be a red belly black, possibly, and Jamil will go through that. Obviously the operators on the other end of the phone go through this and we'll ask a series of questions. Jamil will be over there. If mobile phone reception's 5 kilometres down the road, I would do first aid here with Chris and I would send Jamil down in the 4-wheel drive and I'd send him down to make that 000 call to get help to come to us. If we're remote and we have to get Chris 20 Ks in, so you've got to make that call as you come to it. Let's hope most times you get bitten by a snake, your mobile phone reception, and you can get help to come to you. And that's what we're going to do today. As I said, if you're in one of those situations, everyone, you need to make a decision. If you don't have comms, things turn to shit, things don't go according to plan, you've got to make a decision and you've got to make it work. So you cross that bridge when you come to it, mate. So what we're going to do now, Danger is gone, Chris is responsive at the moment. I need to keep him calm, I need to stay calm. Jamil's sending for help, he's dialing 000 on the mobile phone, so we know the thing. So I'll say to Chris, mate, you need to stay still.
Yep.
Help's on the way, Jamil's on to 000, we're going to have an ambulance here soon. I'm now going to apply first aid to you. So the first thing we need to do, get your snake bite kit, everyone, and start grabbing some stuff out. And the first thing I'm going to do is, as per that thing, I've got more than one bandage. So I can see 2 fang marks on the inside of Chris's right calf here. So I've got an idea, and you felt the snake bite you,
yes, I
and
did.
you pointed down, and I can see the 2 puncture wounds there. Now I need to be able to get a bandage on that. Normally you don't want to elevate the limb up, but in this case, I'm just going to use my first aid kit at the moment, just so I'm going to, actually you've got 2 little scars or whatever right there. We can pretend that they're
that's perfect.
They're the snake bite. It looks like a big king cobra got him there. So the next thing we're going to do is get a pressure bandage over the bite site. If you only have one bandage, you would go from there and work up, okay? But I've got more than one bandage. Make sure you've got more than one bandage. We're going to go over the bite site. So here we go, just getting it started is the hard bit. And we need it nice and firm, everyone. Nice and firm. These are the stretchy compression bandage. Hopefully you can see that there, Jamil. It'll be all right in the tripod at the moment. Oh, you're going to, yep, beauty. Come in nice and close. So we get a nice firm bandage over the bite site. We've got to work quick. We know there's help on the way. And we keep reassuring Chris the whole time. We say, mate, help's on the way. Everything's going to be okay. We're going to get this on. You start telling them stuff like, no one's ever died from a red-bellied black bite. Start reassuring them. That way they don't panic. We've got this sticky stuff here that sticks onto itself like that. So cut that, and that's that stuff I've been talking about, that sticky stuff there. It is absolutely brilliant. Next thing I do, we keep working quick. We go with our big compression bandage here. We keep the toes exposed so we can check for circulation. We get it started. We might have to lift his foot up a little bit here and work our way up. And we go over that again. So nice and firm. These compression bandages here, everyone, don't have the indicator on. I'm going to show you the ones I got the other day. So we need to work all the way up Chris's limb here. And if we get to his shorts, we go over the top of his shorts, everyone. Righto, these bandages don't come with a... and the worst thing here is trying to find the end of them. It's like bloody masking tape. So here we go. Get that on. Work smooth. Work quick. Try not to go too quick. Just keep it nice and smooth. So we get that stuff on just to hold the bandage on. If you've got the clips, that's fine. And you can see that stuff, it sticks to itself. Righto. So I've got most of the limb bandage now. That's not good enough. I'm going to go again. I've got another bandage. I'm going to keep going. I'm going to get pressure all the way up. And I'm going to go over his clothing. If you've got to go over the clothing, that's what you do. I won't go up any higher, mate. So, but normally I would try and I would go up as high as I could there.
Yeah, you can go up.
That's all right.
If you want to go, yeah, you're all right. No,
so we get the limb. We keep going around, nice and firm. We don't want to cut the circulation off. Righto.
It's all about safety.
Yep. So let's get that stuff again. Wrap him around. Stick him on. If you've got to use tape, insulation tape, gaffer tape, who cares? So, I've got another one here. I'm going to go again. The more compression you can get on, the better. I'm only doing this now, guys, because I want to show you these new bandages that I've got here from the pharmacy the other day, and a lot of the proper snake bandages will have this on. So, they're like a rectangle there. When you stretch it, the correct pressure is when it turns into a square, if you can see that. Okay, stretch it so it becomes a perfect square. That's the correct tension. So I'm going to go again. If you got enough bandages, just keep going, guys. Keep getting that pressure on. As I say, getting it started is the hard bit. Stretch it out so you see the square form, and that's how tight you want it. I've got to get his leg up a little bit so I can, so stretch it so you see the squares appear, and we're going to go up again. Get this bandage on. These are good, they're nice long ones, these ones.
Hanging in there, Chris? Hanging in there?
Yeah, bro, yeah.
He's all right. And we keep reassuring him the whole time. You always reassure the patient, everyone. Just say, mate, Jamil's back from the phone. Even Jamil would come back and say, ambulance is on the way. And you keep reassuring the patient. You say, mate, righto, help's on the way. Stay nice and calm. Everything's going to be all right. Keep reassuring the patient. And as I said before, guys, even if things are looking bleak, don't tell the patient that.
Just got to stay calm.
Keep staying calm. The person doing the first aid, it's important you stay calm as well.
Yeah, that's right.
I'm going the wrong way here. What am I doing? If you need to, you can get Chris to... Mate, can you put a finger on that for me, please?
Yep,
Just
no
so
worries.
sort this shit out.
Yep.
Righto. Thanks, mate.
No worries, Paul.
Around we go. Okay. I made that look hard, but anyway, we're in business now. So, now we get the foot down. So we've got the compression bandage on. You can just throw it on me there for a minute, Jamil. So, compression bandage is on. Chris is staying as still as possible. Help's on the way. What we can do now, Rafa's come in to help. He said, I don't like snakes, everyone. He's out of it, sticky beak. So what we could do now is splint. Now, what can we need to, you don't need to, but they do recommend if you can splint. If I know Chris is going to stay nice and calm like this, he's not going to move, this is a perfect position for you. You're comfortable, your limbs wrapped, you're not moving. What we can do, you can use the other leg as a splint if you want. This is where the triangular bandages come in handy, everyone. This is an old one that I'm going to use for the demo per. Just grab them out, wrap them up like that, throw it under, and if you need to, you can tie his legs together and use his other leg as a splint. I'll just do it soft for now. Okay, so the other thing too I said before is we need to give a rough area of where the bite was. So we mark roughly where the bite was on the front, okay?
That's right, Paul.
And then we go 09, 1700. (09) 1700. So that's roughly, Chris come over and told me, today's the 9th, Sunday the 9th of February, at about 5 o'clock in the afternoon. So I've marked roughly where the bite is. with my Sharpie texter here, 091700, which is 5 o'clock in the afternoon.
right.
So that's roughly when you got hit. So when you get to hospital, mate, via ambulance now, because they're on their way, we know roughly where the bite is, or the doctor will, and they know he got bitten on the 9th at 1700 roughly. Okay, so that can help the doctors do their calculations, and I think it all with anti-venin and all that type of stuff. If you're wondering what you can use for a splint, you can use anything. And I won't put it on, guys, but a tent pole, okay? And we can use more triangular bandages and get that tent pole on the leg so that Chris can't move it, okay? And we can splint his whole leg. We can use that tape, where is it? We can even use that tape to get the splint on. Just wrap it around there, and up on his upper thigh. Use that tape, that sticky on tape there. It is absolutely brilliant. That's how you do it, everyone. And we hope now that the ambulance arrives in quick time. They get here, we give a quick brief of what happened.
Yep.
You're still conscious, the ambos can ask you what's going on. So we think he's been hit by a red belly black, and they'll take over from there. The paramedics will take over, mate. They've got their procedures, they'll get you in the ambulance and they'll get you quick smart to hospital, and the doctors will take over and go from there. Could be a dry bite. They may not have envenomated you, the red belly black. Who knows? If you do start showing symptoms,
Happy that we got it wrapped up.
yeah,
That's the main thing.
this is the main thing, guys. And I've read somewhere that the likelihood of dying here in Australia, if you get the compression bandages on, is very, very slim, as long as you're not too far from help. If you're close enough to help and you can get the compression bandages on, there's a fair chance Chris will survive, okay? Obviously the type of snake that hits him plays a big part. I'd rather get hit by a red belly black than by a taipan or an eastern brown or a death adder, something like that. Red belly blacks are still bad, but you've got more of a fighting chance.
Exactly.
Even if you got bitten by a brown, mate, keep reassuring him. So that's all right, mate. That's all right. No one's died from getting these on. We got ambulance on the way. Keep reassuring the whole time. If I've left anything out, I do apologise. Put a comment down. Chris, thank you so much for being my
worries.
guinea pig today, mate.
No
really
worries.
appreciate it. Be able to show everyone on
Pleasure to be on
YouTube.
this.
Jamil, thanks for being on the camera. There you go, guys. Snake bite in Australia. Very, very important. What I want you to do, get on Facebook. Go out, if you do not have a snake kit, go out and buy one or make your own. Please, go and do it. If you're into camping, you follow me, there's a fair chance you do go camping. Make sure you have a snake bite kit. Make sure you've got a first aid kit. Separate your snake bite kit from your first aid kit, so you don't have to go through there looking for what you need. You tip this out, everything's at your fingertips, it's ready to go. Stay calm, keep your patient calm, keep a clear head, don't panic, and let's be safe out there when we go camping. Righto guys, catch you next time. Put a comment down. Go and make your first aid kit up and your snake bite kit. Send me some photos through on Mr. Buckaroony through Messenger, through Facebook, and let me know, eh? We'll talk to you in the next live feed. Thanks again, mate.
No worries.
See you,
Thank
Zay.
you, Paul.
Catch you later.